In this past week, we've been getting in reports of medical apathy from different states across the country, be it a peon turning into a surgeon in Haryana or a ward boy treating patients outside the ward in Uttar Pradesh. And today is yet another appalling report of medical negligence, and this is from the state of Tamil Nadu. This is in the Dindigul district of Tamil Nadu, where a woman bleeding profusely from her nose can be seen being stitched up by an alleged mortuary staffer. The bleeding woman had not even been given anesthesia, is what we're being told, while she was being stitched up. The woman, who had been injured in a car accident, was rushed to a nearby government hospital, where she was told there was a shortage of doctors and was asked to go elsewhere. When the public demanded here that she be given first aid, that is when the mortuary staffer stepped in. We have with us our correspondent Pramod getting us further inputs. Pramod, time and again, this is the third such report that we're playing out. We've seen this happening across major states in the country, and today in Tamil Nadu, where you have staffers, peon boys, sweepers stepping in, saying that they're lending a hand to the doctor, helping out. But this is horrifying. Anything could go wrong.
Well, surely is a lot of discrepancies are there, but as you could see on that visual, there is one lady. Totally 5 people were injured in a car accident near Dindigul, and what happened is that they were rushed to the nearby hospital, which is this one. And that point, there was the hospital staff have stated that there is no doctor, so you have to go to another hospital. But the public in that spot stated that they've been brought to the place and they need first aid. Once after first aid, they can be moved to the Mortuary hospital, the bigger general hospital. That is when what they have done is that they have asked this particular person who the area from that area they claim to be a person who works in the mortuary, but the doctors on their side they're claiming that he's generally called as a person who is a in-house staffer. That way they are trying to only classify him, and based on it they are trying to say that he is equipped to do that. And the shocking part is that they claim that he has been doing it for more than 4 years. But you could see that the lady was placed on the particular the bed, and she's actually crying. She's saying it's hurting too badly, and you could see the way he's stitching it, blood is oozing out, and that she had to go through that struggle, and that's the reason the video was brought out. The doctor in that area still tries to maintain that he is a staffer, so he has all the ability to do that, but that doesn't seem to be like that. If you go through the medical records, there is no such way, because he's not wearing adequate clothes. And given the fact that
Pramod, that she wasn't even administered anesthesia, nor wearing surgical gloves. Yes, Pramod, as you're emphasizing there, nor wearing surgical gloves, the required hygiene which should be in place, and nor was the patient given anesthesia.
Well, that is true. We try to confront the doctor when we asked if he's constantly the doctors try to say that he is one of the members and there is no classification he works only in the mortuary or he's like that, but everybody can do first aid. But when asked if the person is doing first aid, how is that so much blood is the lady's bleeding so badly, and how is that he's not wearing any gloves or protective measures? The doctor at that point states that the doctor was not present during the period it occurred, and that way they are trying to subjugate it. But you could see on the visuals that this person is trying to stitch a wound to a doctor inside a hospital, a government hospital, where you're supposed to have staffs particularly who have knowledge about doing that, and you cannot escape by saying that the person has been doing it for 4 years, so he can do it again.
Absolutely. Is a justification, more shockingly, that's coming in from the medical staff in using the mortuary staffer there. Pramod, many thanks for getting us those inputs. And as we've been pointing out, this is not just the one standalone case. On a very regular basis, such incidents of medical negligence are being reported. The next that was reported from Rohtak in Haryana, a sweeper and a ward boy turned surgeons operated upon a patient with a head injury. The duo gave stitches to the patient's bleeding scalp. The hospital's senior medical officer allegedly present somewhere else on the hospital premises, and this entire incident that took place at a government hospital. An investigation now has been launched in this.
अगर मान लो कोई कर्मचारी अगर स्टिच वगैरह करता है किसी भी हेड इंजरी का जो अगर पेशेंट आता है, तो अगर कोई इसमें कोई दोषी मिलता है अगर इस तरह से, तो उसको हम जो कानूनी कार्रवाई जो बनती है अनुशासनिक कार्रवाई जो बनती है हम उसको करेंगे। कड़ी से कड़ी जो भी अपनी कार्रवाई होगी वो हम उसको करेंगे।
किन पर कार्रवाई होगी और क्या आपको
जो भी दोषी मिलेगा इसके अंदर उसको हम कार्रवाई करेंगे।
And in yet another equally shocking incident where you have a ward boy found treating a patient outside the emergency ward of a government hospital in Kanpur. Now this is not even inside the hospital, this is down outside just at the road next to the hospital. There was no nurse or doctor found attending to the patient here. The woman had a head injury and was being treated on the floor. We're also going to be getting in more viewers calling us on this with respect to absolute negligence here that is on display. And in each of these cases here, Pramod, what's common here in each of these three cases, that these are government hospitals, and the scenario being typical, that a given government hospital there being short-staffed, or in fact saying that the doctor was busy elsewhere, and you have these other staff members who simply stepped in to help the doctor.
Well, that is true, and as you mentioned, the first point being short-staffed, it is the government only that can handle that situation. But on the other hand, on the ground, there seems to be some kind of mentality where the people, the staffs, many of the staffs, as we've seen from the ground, think that they are doing a favor to the people if they come to the government hospital, which is not, because the people are entitled to go to the government hospital. The government functions for them, and they are entitled to adequate medicines and proper treatment. But this is what is not happening. If I have to reiterate this particular case, the people who have gone with that lady claim that he was a mortuary staff. The doctor is not ready to accept it. The doctor is just generalizing him, calling it as a garden variety staffer of the hospital. And the second one is that you will not bleed that profoundly when one time someone is trying to stitch you. You're supposed to be given local anesthesia so that you will not feel the pain. And the second thing is, you could see that senior lady lying on the stretcher and she's wheeling. And even after that, the boy or the person who is trying to stitch her is not stopping. It's as if like he wants to finish the job immediately and leave. If such a case occurs, there is an accident, if someone is brought to the hospital, the doctor is supposed to come there immediately. That is what the actual rule mandates. But here you could see that nothing of those sort is followed, but another just a normal explanation claiming that either that the person has experience, or that the doctor, concerned doctor, was not present, so they do not know about this kind of harsh episodes.